Minisitule evunaanyizibwa ku byobulamu eraze okwennyamira olw'omuwendo gw'abalwadde ogweyongera buli lukya abakwatibwa ekirwadde kya COVID-19 ssaako n'ogwo ogw'abafa. Okusinziira ku Dayirekita avunaanyizibwa ku byobulamu mu minisitule y'ebyobulamu Henry Mwebesa agamba nti bw'ogeraageranya sipiidi omuwendo gw'abalwadde kwe gulinnyira ne bwe gwali mu kirwadde kya COVID-19 nga kyakabalukawo kiraga nti embeera gye tulimu ya mutendero gw'okubiri ogw'ekirwadde kino.
Most affected group this time, the age group is 20 to 39 years old, and that during this period the intensity of severe and critically ill COVID patients is higher than it was in the previous first wave of the pandemic. So in this wave, the severity of the conditions is higher. In the first wave, it took 3 to 4 months to get to the full-blown epidemic. But in this case, it has taken us less than 10 days to rise to the highest level.
Ono agamba nti ebintu ebyenjawulo bireetedde omuwendo guno okweyongera awamu n'okulinnya ku sipiidi ey'eyiriyiri omuli ebyentambula eby'olukale n'ensonga endala.
Taken us less than 10 days to rise to the highest level. The increase in number of cases coupled with deaths is largely due to compliances in adhering to COVID-19 public health preventive measures. As many of you will know, the problem we are having, if you go to markets, the way people are behaving without any masks, without any hand washing, and the crowding in markets. If you all know about the parties which are going on with so many numbers, over 1,000. You all know about what is happening in funerals extending to 2,000 people.
District ye Kampala Wakiso ze zimu ku ezo ezisinga abalwadde abangi era ng'okusinziira ku ye agamba nti newankubadde nga district endala tezimenyeddwa wabula nazo zandibanga ziri mu bulabe obw'enjawulo olw'ensonga nti bandibanga tebalina byuma bikozesebwa kukebera kirwadde kino awamu n'ensonga endala.
Kampala, Wakiso, Gulu, Amuru, Moroto, Arua, Mbale, Masaka, Oyam, and Kalungu. Those are the districts which have reported the highest cases of numbers in the last 14 days. However, this does not mean that other districts are doing well. Actually, what it may mean is that those districts are not testing and are not vigilant, and not carrying out surveillance, and not reporting.
Gye buvuddeko amatendekero g'ebyenjigiriza gaddamu okusomesa abayizi b'eggwanga wabula okusinza ku minisitule egamba nti n'eno nno tekitudde anti ekirwadde kya COVID-19 kyatuuseyo dda. Ono agamba nti waliwo amatendekero agatali gamu agaziruliddwamu abalwadde bano ng'era kino kiva ku butagoberera nnambika ya minisitule y'ebyobulamu omuli okwambala enkampa ku mimwa awamu n'ennyindo, okunaabanga, okwewa amabanga n'ebintu ebirala.
Total of 29 schools from 17 districts have recorded a total of 803 cases and 1 death. That's in schools. 803 cases, 17 districts affected, and 29 schools. That was a week ago. The affected schools include 10 nursing schools, 11 secondary schools, 7 primary schools, 1 PTC, and 1 tertiary institution. Some universities have also reported cases and are under investigations. The main drivers of transmission in these schools are usually overcrowding and certainly non-adherence to SOPs.
Ate ku bufu abo aboolekera nnyaffe Uganda okuva mawanga ag'enjawulo ono agamba nti abaayimirizibwa be bava mu ggwanga erya Buyindi era n'ategeeza nga bano bwe bali mu mutendero ogusooka era nga waliwo bingi nnyo ebisaanidde okuba nga bigobererwa.
Aircrafts in a state of emergency, if it is originating from India, overflying our airspace, but is in a form of an emergency, certainly they are allowed to land. Also, operations related to humanitarian aid, medical evacuation, and diplomatic flights approved by the appropriate authority. But also important to note that we also have our Ugandans who had gone to India for treatment. They are allowed to come back, but of course when they get here, there are some stringent measures If you are Ugandan, you have to return, but we have to test you on arrival.
Wabulera n'omutendera ogwokubiri omuli eggwanga erya Amerika, eggwanga erya Kenya, Ethiopia n'amawanga amalala nabo balina ebisaanyizo bye basaanidde okuba nga bagoberera.
Travelers from category 2 countries, these are USA, United Kingdom, United Arab Emirates, Turkey, South Africa, Ethiopia, Kenya, South Sudan, and Tanzania. Any traveler from these countries, including Ugandan nationals and even residents in Uganda, will be subjected to a PCR test on arrival at the airport at their own cost.
Ate ku bufu bw'okugema onagamba nti abantu abamaze doozi zaabwe ez'ekirwadde kya COVID-19 babeera bali yaddeyaddeko okusinga ku abo abatannabagemebwa awamu n'abo abaakafunako ekitundu. Dr. Henry Mwebesa ajjukiza bannansi ogenda okumalayo doozi zaabwe ze bateekeddwa okufuna olw'ekirwadde kino ekya COVID-19 agambye nti eddagala weeriri.
We resolve that all persons who receive the first dose of AstraZeneca vaccine and have completed 8 to 12 weeks should visit again and receive their second dose. We recall initially we had said that let's first go with first dose. But now we have allowed people to come for their second dose. So to this effect, administration of the second dose commenced on 21st May 2021. That was exactly 6 days ago. So all those who are eligible are encouraged to ensure that they access the vaccine from the nearest vaccination point.
Omuwandiisi w'enkalakayira wa minisitule y'ebyobulamu Dr. Diana Atwine atangazizza ku kirwadde kya COVID-19 okubanga kati kirya n'amabujje.
Say that COVID now this business of saying, you know, for me I'm young, you know, I don't have any hypertension, I don't have diabetes, therefore I am safe even if I don't get vaccinated. I think that notion should get out of our head. We make sure that all of us take precaution and make sure that we avoid infection, because you do not know how your body will react even when you are young, even when you don't have any comorbidities.
People are more socially active and they go out, they interact more with others. As a result of that, their risk for exposure is high. But it is important to understand that the genetic background that makes the person who is 50 years old to have diabetes and hypertension is present with us even when we are young. So it seems that COVID-19 more or less excavates that background.
Omubaka w'ekitongole ky'ebyobulamu mu nnyaffe Uganda ekya World Health Organization Jonas Tegenold Mariam avuddeyo n'ategeeza nga ebiwandiiko ebiweebwa abo abamaze okugemebwa ekirwadde kya COVID-19 we bitali byangu byakujingirira.
We are not talking about forgery of test results. We are talking about forgery of vaccine certificates or vaccine books or vaccines notices. So what we tried to, I think the criteria which Uganda is using here, which says that we only take people who have been, we only accept vaccination cards from countries which are over 50% vaccinated, is also an effort to ensure that the vaccine certificates are also genuine.
Walitukido olunaku olwaleero nga baakakwatibwa ekirwadde kya COVID-19 mu nnyaffe Uganda bali 4,195 ate abali ku bitanda nga bayinda nabo bali 194 ate abaakava mu bulamu buno obw'ensi bali 361. Isa Kigongo ku lwa Channel 44 olweggulo.